Hello, I'm Dr. Kaushik Reddy, Consultant Orthopaedic Surgeon working at Apollo Hospitals, Jubilee Hills. Today I'll be talking about ACL injuries. ACL is called the Anterior Cruciate Ligament. It is one of the most common injuries which happen in the knee joint. So ACL is like a rope which is there in the front of the knee which holds both the bones together, and it also helps in the stability of the knee joint. So ACL injuries are common in young active adults. So most common during high demand sporting activities like football, basketball, cricket, but it can also occur when there is any slip and fall from the stairs, or there is any road traffic accidents, or even while dancing or any of those activities. So the ACL injury can range from a minor sprain of the ligament to a complete tear of the ligament. So how do we diagnose these ACL injuries? So ACL, when somebody has any injury during any of these activities and they feel a sudden pain or any popping sound if they hear, then they need to consult an orthopedic surgeon. So an orthopedic surgeon will examine the patient and he'll advise them certain tests. So an MRI scan is the most useful investigation to identify whether the ACL has sprained or it has torn completely. So once the diagnosis is confirmed, then what is the treatment for these ACL injuries? So the treatment for ACL injuries, initially when the patient has any ACL tear, then there will be a lot of pain and swelling in the knee joint. So the doctor will prescribe some medicines to reduce that pain and swelling, and a brace is very useful initially because the brace will support the knee joint. So you can walk by using a brace, and then good physiotherapy will help in healing the ACL injury. So is surgery needed for all the ACL tears is a very common question. So no, surgery is not the solution for all the ACL tears. Most of the ACL tears, especially any sprain of the ACL ligament or partial tears of the ACL, may not need any surgery. So good rehabilitation and physiotherapy will help in healing of the ligament. So when do they need surgery? If someone is a sports person or a professional and he is having instability, the giving way sensation in the knee joint, and he's got significant pain because of any meniscus tear or any cartilage damage to the knee joint, and if he is having that instability symptom, then yes, then surgery is needed for those people. So what is the surgery that is needed for ACL injuries? So ACL injuries can be treated by an arthroscopy surgery. Arthroscopy surgery is a keyhole surgery where we insert a 4 mm camera inside the knee joint, and we reconstruct the ACL ligament using another tendon from the patient's body called a hamstring tendon. So this is a very common surgery which is being done, and it is giving very good results. So ACL surgery is a daycare surgery which is a minimally invasive surgery with less minimal pain after the surgery. Thank you.